This video aims to provide an overview of clinical trials in the last 20 years, assessing the therapeutic effects of garlic on common human diseases, such as cancer, cardiovascular pathologies, diabetes, metabolic disorders, osteoporosis, and skin diseases, mostly focusing on its antioxidant, anti-inflammatory, and lipid-lowering effects. Garlic is a polyphenolic and organosulfur-enriched nutraceutical spice consumed for hundreds of years. Research have shown excellent health-promoting and disease-preventing effects on many common diseases, such as cancer, cardiovascular and metabolic disorders, blood pressure, and diabetes, through its antioxidant, anti-inflammatory, and lipid-lowering properties. Human interventional trials considered, the consumption of garlic has been reported to modulate multiple biomarkers of different diseases. In addition, its combination with drugs or other food has been shown to be safe and to prolong their therapeutic effects. Garlic is not only used to increase the aroma, flavor, and color of food, but are also considered for therapeutic purposes for their potential prevention of different acute and chronic diseases. That includes improved anti-inflammatory and antioxidant properties, as well as chemopreventive, anti-proliferative, anti-angiogenic, anti-diabetic, and cardioprotective effects. Garlic is considered as a functional spice because of its diverse array of nutritional constituents, phytochemicals, and fiber. It contains high levels of potassium, phosphorus, zinc, and sulfur, moderate levels of selenium, calcium, magnesium, manganese, iron, and low levels of sodium, vitamin A and C and B complex. Much attention has been given to its main bioactive compounds: polyphenols, flavonoids, flavonols, tannins, saponins, polysaccharides, sulfur-containing compounds, including alliin, allicin, ione, allyl-propyl disulfide, DATs, S-allylcysteine, phenyldithiones, SAMC, enzymes, like allinase, peroxidase, myrosinase, and other compounds, such as beta-phellandrine, phellandrine, citrol, linalool, and geraniol. Moreover, it contains 17 amino acids with 8 main amino acids. Generally, bioactive compounds are present in intact garlic, but, after chopping or crushing, a higher number of compounds, such as allicin, DAS, DADs, dithiones, and ione have been found after different types of chemical reactions. Based on several studies for cancer treatment, between raw garlic and specific garlic supplements. For example, the bioavailability of allicin from 9 garlic-based food and 13 garlic supplements was tested on 13 subjects measuring the concentration curve of breath-allomethyl sulfide, the most important garlic metabolite, highlighting a higher bioavailability of allicin from garlic supplements than that of crushed raw garlic. Garlic has strong antioxidant properties due to its nutritional and phenolic compounds. The antioxidant properties of garlic decrease reactive oxygen species, which are produced through increased metabolism or chronic inflammation, thus preventing atherosclerosis. In a randomized double-blind placebo-controlled nutritional intervention, garlic extract, GE, intake at 400 mg/day for 3 months enhanced antioxidant status, reducing in turn the cardiovascular risk in obese patients. Moreover, in diabetic patients after 30 days of supplementation with 3.6 grams garlic clove per day, enhanced antioxidant activities. Recent meta-analysis of clinical trials demonstrated that garlic supplementation modulates oxidative stress markers, including total antioxidant capacity, DAC, and malondialdehyde, MDA. For example, the garlic tablets exerted a significant role on oxidative stress via decreasing MDA levels and improving TAC concentration in postmenopausal osteoporotic women at a dose of 1200 g allicin daily for 1 month compared with placebo. Furthermore, garlic administration synergistically improved resistance and endurance, the training effect against oxidative stress by modulating oxidative stress markers, such as TAC and MDA, after 8 weeks of treatment at a dose of 250 mg garlic capsule per day for 8 weeks. Finally, a few crossover studies showed that the consumption of a high antioxidant spices diet, including garlic, improved antioxidant status in cancer patients and postprandial lipemia in healthy overweight adults compared to low spices meal. In addition, consumption of 400 mg garlic and 1 mg allicin per day decreased oxidative stress after 9 weeks in pregnant women at risk for preeclampsia but had no significant effect on TAC and pregnancy issues. Various chronic diseases, such as cancer and cardiovascular diseases, are related with inflammatory processes. In these conditions, different types of therapeutic and natural tools have been used to prevent them. In this context, garlic has shown to exert potent anti-inflammatory effects by decreasing the inflammatory biomarkers in end-stage renal disease and adult patients. A double-blind randomized clinical trial showed a significant reduction of inflammatory cytokines when standardized garlic extract was administered at 400 mg twice a day for 8 weeks in peritoneal dialysis patients. In addition, a meta-analysis revealed that garlic supplementation reduced serum concentrations of tumor necrosis factor alpha, TNF-alpha, and CRP, but did not affect serum adiponectin and leptin in healthy adults. Immune cells are responsible for the anti-inflammation effect. Aged garlic contains various compounds that can improve immune systems by modulating cytokine production. For example, the consumption of aged garlic supplementation at a dose of 2.56 grams per day for 90 days increased the activity of immune cells and decreased inflammation in obese adults. Interestingly, the same dose of GE boosted immune cell function, decreasing the severity of cough and flu and increasing urinary cytokine excretion. In addition, in a randomized, double-blind, placebo-controlled clinical trial, after taking age supplement at a dose of 3.6 grams per day for 6 weeks, reduced obesity-induced inflammation was observed, by releasing hydrogen sulfide via increasing its endogenous products. Moreover, garlic supplementation increased microbial richness and diversity and improved inflammation condition in patients with uncontrolled hypertension. Garlic has shown promising lipid-lowering effects on hyperlipidemic patients through the reduction of serum cholesterol concentration. In diabetic patients, the combination of garlic with olive oil effectively regulated serum cholesterol and triglycerides levels, as well as dyslipidemia. Garlic in non-powder and powder forms undoubtedly reduced serum lipids levels over a 1 to 3 month period. After 4 months, the consumption of GE raised HDL and lowered LDL and cholesterol levels in 23 hyperlipidemic patients. Several studies showed that the administration of aged black garlic or garlic tablet at a dose 300 mg or 6 grams 2 times per day for 4 or 12 weeks reduced the levels of total cholesterol, DC, triglycerides, and LDL, while it elevated that of HDL in patients with mild hypercholesterolemia and dyslipidemia or type 2 diabetics. Moreover, aged garlic reduced DC and TG at a dose of 2.4 grams per day for 2 weeks in patients with coronary artery disease. In another randomized, double-blind, placebo-controlled trial, 10.8 mg per day of garlic powder tablet for 12 weeks reduced the triacylglycerol concentration in healthy volunteers. Furthermore, enteric-coated garlic powder tablet containing 400 mg garlic and 1 mg allicin 2 times daily reduced cholesterol and LDL levels, showing protective effects in a single-blind study with 150 hypercholesterolemia patients. Cancer is one of the main causes of deaths worldwide. Based on National Cancer Database and the surveillance, epidemiology, and end results, about 16.9 million people were identified with cancer in 2019, and this number will probably rise to more than 22.1 million in 2030. Credible evidence for an association between garlic intake and colon, prostate, esophageal, larynx, oral, ovary, and renal cell cancers has been reported, even if all studies were observational, and the number of such trials that are scientifically considered valid in this analysis is remarkably few and the number of subjects involved generally small. As a result, relations between garlic and reduction of risk of cancers are still uncertain. Interestingly, garlic can provide symptomatic relief of various cancer conditions, including breast, colorectal, colon, gastric, lung, and pancreatic cancers. It may be a therapeutic potential for specific cancer treatment that has been reported in human-based clinical studies. In this context, personalized diets with supplemented functional elements, including functional phytochemicals, such as allyl sulfur compounds or allicin, have provided high amounts of antioxidants to patients in chemotherapy and in remission. A randomized controlled trial showed that dietary intervention for 6 months among breast cancer survivors increased adherence to a Mediterranean-style diet and consequently raised the consumption of anti-inflammatory spices, such as garlic. Another randomized double-blind factorial trial on garlic highlighted a decreased appearance of precancerous gastric lesions or gastric cancer, while a consumption of 200 mg of synthetic alitridum, diallyl trisulfide, with 100 mg of selenium reduced gastric cancer risk. Similar results were found with 7.3 years consuming garlic supplementation at a dose of 200 mg. Caps reduced advanced gastric lesions, increased serum folate, and improved moderate folate deficiency in patients with gastric lesions. In addition, long-term consumption of garlic reduced gastric cancer, reduced precancerous gastric lesions, and reduced mortality rate. In addition, The intake of garlic supplements for 2 years was significantly associated with decreased risk of colorectal adenoma, which is a precursor of colorectal cancer. Epidemiological studies of randomized controlled trials explained that the administration of garlic extract decreased colon adenomas and colorectal cancer in patients with it via increased NK cell activity. Correspondingly, aged garlic extract at a dose of 4 caps per day for 6 months prevented the reduction of NK cell number in patients with liver and pancreatic cancer. Few epidemiological studies conducted found a significant inverse relation between consumption of raw garlic or garlic components 8.4 grams or 33.4 grams per week for 7 years and reduced lung cancer risk. Finally, garlic extract showed preventive effect on febrile neuropathy after receiving chemotherapy in patients with hematological malignancies, potentially reducing the risk of chemotherapy-related febrile neutropenia after receiving garlic extract at 900 mg per day for 3 weeks compared with placebo. Numerous mechanisms have been recommended to explain the chemopreventive effects of garlic, including the inhibition of DNA adduct formation, the inhibition of mutagenesis by blocking metabolism, through its free radical scavenging, or by decreasing cell proliferation and tumor growth. Clinical trial on gene expression related to immunity, apoptosis, and xenobiotic metabolism in humans, after consumption of 5 grams raw, crushed garlic daily for 10 days. A single meal containing raw crushed garlic activated the expression of 7 genes and thus inhibiting tumorigenesis, the production and formation of tumor. Currently, cardiovascular disease, CVD, represents the major cause of morbidity and death worldwide, with 17.3 million deaths per year, a number that is anticipated to rise to over 23.6 million by 2030, 77. Many risk factors affect the development of CVD, including type 2 diabetes mellitus, obesity, resistance to insulin, high blood pressure, metabolic syndrome and high serum triglycerides levels and plasma lipid profile. Based on current research, garlic can significantly reduce the risk of atherosclerosis, hypertension, diabetes, hyperlipidemia, myocardial infarction, and ischemic stroke, thanks to the synergistic effects of its nutritional and phytochemical components. From a dietary approach, garlic has the potential role in the prevention and treatment of atherosclerosis and myocardial infarction. A randomized trial performed with garlic on adipose tissue surrogates for coronary atherosclerosis progression, that reported a decrease of the coronary atherosclerosis growth at dose of 250 mg garlic daily for 12 months. In addition, garlic prevented atherosclerosis process by developing microcirculation in patients at a dose of 2,400 mg aged garlic extract per day. Moreover, garlic extract blocked atherosclerosis progression 1.5-fold in postmenopausal women at a dose of 500 mg for 12 months after administration. Another randomized double-blind study demonstrated that 2,400 mg aged garlic extract per day for 52 weeks decreased low attenuation plaque in coronary arteries of patients with metabolic syndrome. On the other hand, aged garlic extract at 6 grams daily for 12 weeks reduced the levels of lipoprotein B and raised HDL levels, showing cardioprotective effect in patients with mild hypercholesterolemia. In addition, garlic extract administered at 400 mg per day for 3 months modified the markers of endothelial function such as cholesterol, total, LDL, HDL, and triglycerides as well as suppressed chronic inflammation in obese individuals. Another meta-analysis suggested that garlic has a cardioprotective effect by decreasing serum TC and TG levels in patients with mild hypercholesterolemia. Metabolic syndrome is a cluster of metabolic diseases, including abdominal obesity, hypertension, atherogenic dyslipidemia, prothrombotic, and pro-inflammatory conditions, and the risk of this disease increases approximately 5-fold and 2-fold in patients affected by type 2 diabetes mellitus and cardiovascular disease, respectively. In this context, the consumption of raw crushed garlic at 100 mg 2 times per day for 4 weeks significantly decreased several risk factors of metabolic syndrome, including blood pressure, triglyceride levels, fasting blood glucose, as well as improved serum high-density lipoprotein cholesterol. Moreover, a double-blinded placebo-controlled study revealed that the treatment with garlic tablet at a dose of 300 mg 2 times a day for 4 weeks along or combined with sulfonylureas drugs led to excellent metabolic control by lowering fasting blood glucose, serum fructosamine, and serum triglyceride levels in patients affected by type 2 diabetes mellitus, also decreasing cardiovascular risk. In addition, administration of garlic clove for 30 days in type 2 diabetic patients reduced blood glucose and lipids metabolism and reduced the serum lipids such as cholesterol, TG, and LDL but improved HDL fraction. Similarly, Administration of 100 mg daily garlic for 5 months and 300 mg garlic twice daily for 24 weeks in diabetic patients decreased blood glucose, cholesterol, and TG and increased HDL levels. Another study revealed that age reduced the risk factors of metabolic syndrome at a dose of 1.2 grams per day for 24 weeks through increased plasma adiponectin levels in patients, without any side effects. Accordingly, aged garlic extract reduced low attenuation plaque in coronary arteries of patients with metabolic syndrome after consumption of 2,400 mg age per day, highlighting its anti-diabetic, anti-lipidic, and antioxidant properties. When blood force gives pressure against blood vessels or arteries walls, hypertension is developed. Recently, garlic showed a satisfactory effect as a hypertensive remedy by regulating high cholesterol levels and stimulating the immune system. A dose-response trial reported that aged garlic extract had an antihypertensive effect by lowering systolic blood pressure in the case of uncontrolled hypertension without any remarkable side effects. Moreover, in moderately hypercholesterolemic subjects, the administration of aged extracts or dry garlic powder at 7.2 grams per day for 4 weeks decreased systolic blood pressure and diastolic blood pressure moderately, 5.5%, through decreasing serum TC and LDL, even if no prominent change in HDL was found compared with placebo. A similar result was observed with raw crushed garlic at 100 mg 2 times per day, that reduced systolic blood pressure and diastolic blood pressure via downregulation of TG level and upregulation of serum HDL cholesterol after 4 weeks consumption in patients with metabolic syndrome. Furthermore, administration of garlic homogenate-based supplementary diet at 300 mg per day for 12 weeks significantly reduced systolic blood pressure and diastolic blood pressure in mild hypertension patients but not in pre-hypertension patients, without any clinical side effects. In addition, the combined intake of garlic and coriander exerted a significant effect on lipid profile, where garlic, coriander or their mixture intake at a dose of 2 grams/day highly modulated body mass index, DC, LDL, and HDL and decreased blood pressure in hypertensive patients. Diabetes is one of the major non-communicable life-threatening chronic and pervasive conditions. It results from an absolute or relative deficiency or resistance to insulin, remaining a prominent chronic disease with the number of diabetics quadrupling in the last 3 decades in the world. Oxidative stress is responsible for promoting diabetes, and preclinical studies showed that garlic active organosulfur compounds reduced hyperglycemia via improving the antioxidant status and circulation of diabetic rats. In addition, the garlic component acts as hydrogen sulfide donors which also control type 2 diabetes. Recently, few meta-analyses demonstrated that garlic may decrease lipid profile and glucose parameters such as fasting blood glucose concentrations and hemoglobin A1c, the 1c, in diabetics patients. In addition, uptake of 300 mg garlic supplementation 2 times per day for 12 weeks significantly improves serum TG, DC, and LDL level and decrease the serum lipid level compared with placebo diabetic patients with uncontrolled dyslipidemia. Moreover, the combination of anti-diabetic drug metformin at 500 mg 2 times per day with garlic at 300 mg 3 times per day for 24 weeks had more potential in the management of patients with diabetes by reducing total cholesterol, LDL, and TG and improving hyperlipidemia. Finally, a double-blind clinical trial in diabetic patients revealed that herbal medicine containing garlic at a dose of 750 mg 3 times per day for 12 weeks had potential effects for diabetes management by reducing fasting glucose blood levels. Osteoarthritis, OA, is an extensive degenerative disease of bone joints, which is related to chronic and disabling pain, where adipocytokines, resistin, and pro-inflammatory markers have a particular role in its pathogenesis. Garlic supplement at 1,000 mg per day has been shown to be effective on symptom relief in overweight or obese women with knee osteoarthritis, after 12 weeks of administration. Moreover, the intake of garlic tablet at 500 mg 2 times daily for 12 weeks showed anti-inflammatory and analgesic effects resulting in reduced pain severity in obese or overweight women with knee osteoarthritis. Another randomized clinical trial revealed that garlic tablet acts as an antioxidant in postmenopausal osteoporotic women. In this study, a significant decrease in advanced oxidation protein products and plasma protein carbonyl plasma levels and a concomitant increase in TAC as well as a reduction of oxidative stress and osteoporosis were found after garlic tablet consumption at a dose of 2 tablets, equivalent 2 grams fresh garlic, per day for 12 months. In addition, A correlation was found between pro-inflammatory cytokine activity and garlic tablet administration 2 times daily for 8 months in postmenopausal bone loss, where garlic modulated cytokine production and reduced osteoporosis in postmenopausal osteoporotic women. Garlic has long been used in traditional and complementary medicine, and several clinical trials have demonstrated the efficacy of its administration or application in resolving symptoms associated with warts, denture stomatitis, venous ulcers, and skin wounds. For example, in preclinical studies age showed wound healing potential in a dose-dependent manner after 6 days application. Treatment of wart virus by improving immune system might be accomplished by intralesional immunotherapy, and it may damage all sores on the body. A randomized control study showed that lipid portion of garlic extract 2 times daily for 4 weeks had greater potential on patients with recalcitrant multiple common warts compared to any other treatment. Similarly, denture stomatitis expresses a common form of chronic oral candidiasis, and a randomized clinical trial study demonstrated that garlic extract at 40 mg 3 times per day could be a potential substitution for denture stomatitis treatment compared with nystatin. Finally, a prospective non-randomized pilot study was performed on venous ulcer patients with herb ointment containing garlic, showing anti-erythematous, epithelizing, and anti-edematous properties, and decreased the venous ulcer area after 7 weeks of application. In recent years, antibiotic resistance against microorganisms has become a serious issue, thus substantial attention is being given to the antimicrobial activities of spices, such as garlic, because of their inhibitory effects against pathogenic viruses, bacteria, yeast, and fungi. The antimicrobial mechanism of garlic may include the inhibition of extracellular enzymes, the deprival of the substrates needed for microbial growth, the morphological change, and the anti-adherence of bacteria to epithelial cells. In addition, garlic tablet garson at a dose of 1,500 mg per day for 7 days has been shown to be effective for the treatment of candida vaginitis instead of fluconazole in women with vaginitis. Moreover, in the case of acute respiratory viral infection, garlic tablet at 600 mg per day for 5 months diminished acute respiratory diseases morbidity 2.4-fold at the first stage and 1.7-fold at the second stage compared to the controls, as a consequent inhibition of infection. Garlic tablets at dose 400 mg daily are also a promising candidate for nosocomial infections in hospitalized patients in intensive care units, and might be used for the prevention of septicemia and urinary tract infections after 6 days of treatment. Garlic intake exerts a protective effect also in gastric diseases. Meta-analysis on human liver enzyme and evidence that garlic supplementation significantly reduced liver enzyme aspartate transaminase levels, meaning a healthy liver. Finally, a population-based study found that frequent consumption of raw garlic is inversely connected with non-alcoholic fatty liver disease. In patients with non-alcoholic fatty liver disease, garlic powder consumption modulated body components by reducing body weight and fat mass. Garlic is highlighted as a promising candidate for preventing and treating different health conditions. This video has summarized the anti-cancer, cardioprotective, anti-hyperglycemic, antimicrobial, anti-hypertensive, and others effect of the administration of garlic and its preparation through their antioxidant, anti-inflammatory and lipid-lowering activities. Daily intake of garlic would benefit to 1. Fight cancer. 2. Improve antioxidants. 3. Decreases cardiovascular disease. 4. Reduce inflammation. 5. Manage metabolic disorder. 6. Reduce bone risk. Thank you for your time. May you live long and prosper.